as extremely beneficial for ligament, bone health, wound healing, oxygenation, which is part of the healing process. So it's really affecting all of those.
But they take time.
Yeah.
Every tissue has its own cycles of regeneration.
Oh, certainly.
Right? That's why we say we're a new person every 7 years. Well, actually, our eyes are new every 24 hours. Our gut cells are new about every 3 days. And the skin is new about every couple weeks. Whereas bone takes up to 7 years to be renewed.
Yeah.
So you have to allow for not only understanding how much damage there is that you're trying to shift and repair and recover, but you also have to know what the metabolic rate of that particular tissue is.
And the next issue is when you have all your cells divide, so they pass on the present state of their knowledge, the DNA right now, to the new cells. So it's not that they repair and become completely new, but if you add that balance and that regeneration and a proper ATP production, then we have also an increased repair of the DNA. And Dr. Rao explained that redifferentiation of cells, which means we turn them from sick, inflamed cells slowly back into a healthy cell.
Into a healthy cell. And the sick cells, if you can't grow a garden in a swamp.
Yeah.
So if you clear the swamp, now you can grow a garden. So if you want to replace the cells that have died in the illness process or disease process, then what you're doing is, as those cells get replaced, they get replaced by healthy cells in a healthy environment.
Yeah, exactly.
Right? If you try to get a healthy cell to go into a sick environment, of course, you're trying to grow a plant that needs the proper lighting and the proper hydration, well, it's not going to work.
Yeah. We have a lot of people that ask, how often can I use it? How often is it advisable? Does my body get dependent? And I think we spoke about that yesterday about a point. So I'd like to give you an answer, or you give an answer for that.
It's not like creating the artificial dependence of a narcotic.
Yeah.
Or, like Valium or something like that. It's not that kind of dependence, where you're replacing the natural functions of the body, and now the body needs what you're giving it, and you can only maintain it in that state as long as you keep supplying that nutrient.
Yeah.
Well, magnetic fields, once the body's done, you can take them away. Mm-hmm. But again, we started at the very beginning saying that our bodies are deficient anyway.
Yeah. Yeah.
Right? So really you can use it forever, and you're not dependent. But clearing the road idea again, if there's a flood coming, put a barrier up so it won't keep swelling over into the road. So you will maintain it as long as you need to maintain it. That's not dependence.
Yeah.
It's dependence only not in a negative sense, it's dependence in a positive sense, that you're maintaining a higher level of functioning by maintaining the use of the treatment.
Yeah.
Now, let's also remember that as we get older, we don't have the repair capacity that we had when we were young.
And the energy and the build-up capacity.
Exactly. So, in a sense, we do become more dependent as we get older.
Yeah.
Now, we may expect to live to 70 or 80 or 90. I mean, I know people who turn 85 and say, I'm out of here. Yeah. I don't want to stay here anymore. All the reasons I'm here as a human being are gone. All my family's gone. All my friends are gone. I'm done. So if we're not done, but we're at a point where we're too decrepit, and we need a lot of help to keep going.
And like something that I experience, people when they start using the device, it's not like that you feel it it can, depending if you have pain, if you lack in energy, if the right composure is there, you feel an instant change. But what I realize more is people, when they stop using it, they realize a lot more than when they started to use it.
You do get used to the new state.
Yeah, exactly.
Right? When you're sick, you know what you feel like when you're sick, and you don't want to be there. But when you're well, you kind of forget about what it was like to be sick.
Exactly. Yeah, and that's when my mother-in-law, when she stopped using it, she went away for a holiday. She was desperate to come home to her device.
I learned this very early on. I've been doing magnetic field therapies for 25 years.
Yeah.
I learned this very early on with a guy who was having leg cramps.
Okay.
And but he didn't have them every day, and he didn't have them 3 or 4 times a night. He had them now and then. So we got him on a magnetic therapy system, and he says, I don't know if it's working. I still get them occasionally, but maybe they reduced by 50%, but he still got them. So in his mind, because he's still getting them, we hadn't finished the job. He did what you said about your mother. He went away, left his magnetic system. And the increase in cramping went up dramatically. Yeah. Then he realized.
And the example that you bring is really important because that shows that it's not a general cure, because you still need magnesium to reduce the cramping, and if you have deficiencies in the body, that's not just something that's going to wipe the deficiency away, it's just helping with the body processes. You still need to look at all the other things.
Well, and if let's say you're a weightlifter,
yeah,
right?
Yeah.
Let's say you're bench pressing 300 pounds. Right. What if you stop bench pressing for 300 pounds? Go away for a month and don't do anything. Can you go back right away to do 300 pounds? Probably not. Yeah. Most likely you're going to have to drop back to a different weight level to rebuild the capacity to get to that new level. Our bodies are no different. Those processes that we give them the extra juice, right, to do what they can do, and that's where we want to be, then you have to keep using it in order to maintain yourself at that level.
Can you talk a little bit about inflammation and PEMF? Because this is an important one. We know that inflammation is one of the main contributors to cancer, or one of the main problems caused by cancer. So how would that influence?
Well, there's two kinds of inflammation, fundamentally. There's acute inflammation, which is absolutely necessary for life.
Yes.
If you cut yourself, you better have a good repair response. And that's acute inflammation. Now, acute inflammation can be proper or it can be dramatic. In other words, it can be out of balance as well. And so you can assist acute inflammation with PEMFs. And that's where you see the most dramatic results, right away. My wife, for example, broke her little toe. And she started a PEMF system after she broke her toe, and we did the proper splinting and so on to maintain the fracture site. She used her PEMF 24 hours a day. So after breaking it like midday, she used it constantly till the next morning. All the bruising was gone, all the swelling was gone.
Yeah.
Right? She used it continuously for the next 24 hours. That next day, she walked 1 mile in a tennis shoe. Yeah. The day after that, with continuous use, the day after that, she walked 3 miles in a tennis shoe. Yeah. She needed to be using the magnetic therapy acutely in that short-term situation constantly in order to have the healing time dramatically reduced. Normally, if you break a little toe, it takes weeks for you to be able to hobble around normally, relatively normally again.
Dr. Finn Scott Anderson in Denmark made actually a lot of research studies in healing, wound healing and repair, and the times that it decreased was usually about 50%. Yeah.
Yes, that's correct. And then the other kind of inflammation, to go back to the question you asked, the other inflammation is chronic. And that's the inflammation that's present in chronic disease. Yeah. Okay? And what happens is the body, when it finishes the job of acute inflammation, it doesn't stop.
Yeah.
So the environment somehow does not allow the acute inflammatory cells to go away somewhere else and do what they're supposed to do elsewhere in the body. They stay there and they continue to create inflammation. So that's chronic inflammation.
Yeah.
And what PEMFs do is they change the environment, the whole local environment. They change it from acidic to alkaline. They bring in more nutrients, as you mentioned. They rebalance the ions, they rebalance the chemistry of the cell, they stimulate RNA and DNA, they add more ATP. So all of these other aspects of PEMFs condition the environment to be healthier. Then the chronic inflammation can often go away. But there's another important aspect with longer term use of PEMFs is that it causes the chronic inflammatory cells to die off. Yeah. It's called apoptosis. Okay, so apoptosis is the natural process of the body. Old cells die, that's called apoptosis, and they're replaced by the healthy cells. So you cause these chronic inflammatory cells to die off faster, and that decreases the chronic inflammation, but that takes time.
Yeah. But the increase of apoptosis or redifferentiation of cell, that's actually the main effect to reverse inflammation.
Chronic inflammation.
In hip joints, I have clients with massive hip problems or osteoarthritis, inflammation by viral infections. And what I found, this was for me the biggest thing, when you use it, all of a sudden the white blood cells really triple in size. You see the nuclei full on active, and that already shows that they then take care of microbes and viral infections.
If you give the body, I'll give you another example. What's the value of an antibiotic? All it does, we have a misconception about what antibiotics do. All they do is to kill the bacteria. What helps the damage caused by the bacterial infection? Nothing that the medicine does. Nothing that medicine does. So what PEMFs do in that setting is you still might need the antibiotic, whether it's natural or synthetic. But then what you're doing is you're facilitating the body's repair process, the process of actually healing itself. So when you leave a typical doctor's office, they give you the antibiotic, and in their minds, the doctors cross their fingers that your body will take care of business.
Yeah, exactly.
Right?
Yeah.
But that's not finishing the job. A natural medicine doctor is going to say, okay, we need the antibiotic to take care of the acute situation and the severity of it, but now we also need to finish the job by giving you andrographis, you need to echinacea, or whatever you need to do to stimulate the immune system. But then you add more nutrients into the system, you add more alkalinity into the system, you add more vitamin D into the system, right? All of that helps the body to finish the job and minimize the level of damage that's present.
Yeah. I had yesterday at one of the workshops upstairs, they explained the DNA repair and how that actually happens all the time as soon as you remove toxins. And that's one of the effects that we have too. Yeah. So it really starts to...
The toxins turn off the DNA, the repair processes, and then when you remove the toxins, the body does what it's supposed to do.
Exactly.
Right.
Perfect. Thank you very much for that. That was
you're welcome.
Really insightful. Do you have something that I forgot to ask that you would like to share with the world?
Oh, I thought that was pretty comprehensive. Thank you.
Yeah, good.
I appreciate the work you're doing. I think you're doing an incredibly laudable work. And you know, I'm resonant with you, to go back to the PEMF analogy, which is that we really have to understand that when we're treating cancer, it has to be done in a holistic fashion, and that chemotherapy or surgery or radiation can be a piece of a program. And I don't think we can take a judgment on what an individual decides is the best, because cancer is so complex and there's so many different types of cancers that respond better to one thing or another. And that complexity, there's no simple solution to this.
Never ever.
And you have to be reasonably skilled at this and knowledgeable in so many aspects of healthcare.
That's exactly what Truly Heal is about. Like we've covered like the whole range of subjects, and we pull all the pieces together so that it becomes a team. It becomes a holistic process, right, and not just pieces of the puzzle.
My words
Good.
are echoing your words.